Good morning. Welcome to the NAHC Washington update for Thursday, March 26th. The Senate was hard at work last night and finally passed the legislation known as Stimulus 3.0. We expect the House to take this measure up very quickly and possibly pass it tomorrow on Friday. There's much to tell you about it, but I'll try to be as quick as possible. There is relief for businesses, for workers, and particular support for healthcare services. There is a $100 billion fund to help support the cost of COVID-19 for healthcare providers. Much of the detail is missing, but one thing we do know is we'll focus on the cost of COVID-19. It's essential that you keep track of any COVID-19 related costs to have the opportunity to acquire some funding through this $100 billion relief effort. Beyond that, there is funding through the Small Business Administration to support loans and grants and even forgiveness of loans ultimately for small businesses, which is a very high bar kind of level to help through this pandemic time. Workers have relief in the forms of sick leave and unemployment compensation supports. For home health and hospice, here are the following things that stand out. First, for home health, Congress has finally passed the 13-year effort that we've had, led by Senator Susan Collins, to provide authority for nurse practitioners, physician's assistants, and clinical nurse specialists to certify Medicare eligibility and to establish and manage a plan of care. Now, of course, that relates to the scope of practice for those disciplines within particular state law. Congress gave CMS some time to implement this, but we're working to see if we could get an emergency, quick kind of an implementation by CMS. So stay tuned on that. This will allow physicians time to be freed up, will allow you to have stronger communications with the non-physician practitioner community. An additional change authorizes CMS to encourage home health agencies to maximize use of telehealth services. Yes, the word encourage is there. This is not direct reimbursement relief. It fell short of what we're looking for, but we are told by congressional staffers that CMS has indicated its willingness to provide some kind of reimbursement relief related to the use of telehealth. We are awaiting the issuance of an emergency regulation that is pending before the Office of Management and Budget. That may even happen today, and it is hoped for, I can't say expected, that we will see telehealth relief within it. For hospice services, the relief focuses on allowing physicians to do telehealth visits for the necessary face-to-face encounter. This will apply also to nurse practitioners in telehealth services and hospice arena. There's a lot more that we see coming down the road. There are many different suspensions and waivers pending action at CMS covering program integrity, homebound status, physician orders, supervisory visits, and the like. But at the same time, Congress is already at work at what's known as Stimulus 4.0. Stay tuned on that one. All indications are Medicaid will be a big focus of that legislation. So thank you for spending a little time. We'll come up at another update as soon as we have some important information to pass on to you. Have a great day.